welcome. This is Here's to Your Good Health. My name is Linda Prezioso. I'm a nurse practitioner at Family Medical Center, and I am so glad to be back here. I've been out for 2 weeks. It's just been a tough January for me, y'all. Tell you what, and we're going to talk about some of those things tonight, why I missed an entire week of work. I haven't missed an entire week of work unless I had surgery or I had COVID. So it's very unusual for me not to be at work. I just, I'm pretty healthy for the most part, and I don't like to miss work because when you're gone, you got so much more to do when you get back. And I like my patients and I care about them, and it's tough on everybody. My nurse has to call and reschedule everybody, and I usually have a pretty full schedule. But anyway, I was out for a week. And that was I don't know, I've lost track of all the time. I'm not even sure. I think it's Wednesday, right? It's Wednesday, February 1st at 7 o'clock. Okay, I got that much right. So we're going to talk tonight about dizziness, and that's why I was out, because I was dizzy. I'm now a true dizzy blonde, so that's, I don't know, take that for what it's worth, I guess. But anyway, we're going to talk about various things that can make us dizzy and when you need to really be concerned about it and when it's life-threatening. So we're going to go ahead and do all that. I just, I missed the last 2 weeks, and I just felt so bad that I'm just so glad to try get back into the swing of things and get back into normalcy for me, which is, working 4 days a week and coming here on Wednesday nights. And so anyway, here I am. It is February 1st at 7 o'clock. I'm live tonight, so if you got a question or a comment, call me, 407-1111. And we're just going to go ahead and get started. I didn't even realize that I'd been here 2 weeks in the first of the year. I thought, well, I haven't even told my folks Happy New Year, but I think I did. But anyway, Happy New Year again. And this weather's been something too, huh? I'm not good with rainy, overcast weather. I've got to have sunshine. So I could never live I was raised in Minnesota, and that's cold and gloomy like this, a lot in the wintertime. So I have that seasonal affective disorder, it's called SAD, and it really is, it makes you depressed, and I get depressed when I can't see the sun. So I'm pretty ready to see a little sunshine, but the weather isn't too promising for sunshine till about Saturday. So maybe I'll see a little peek of the sun tomorrow at some point. I don't know. But anyway, it's good to be back, and we're going to, like I said, talk about dizziness. There is a lot of viruses going around. There's a lot of sinus type things. Of course, there's still flu and COVID, although that is not as prevalent for my folks as it was like in December. In November and December, it was pretty bad. Some poor people had both COVID and flu, and that's just a double whammy that nobody should have. But anyway, I did have a COVID positive yesterday, but the majority of people are upper respiratory viral infections, and they make you miserable. A lot of postnasal drip, a lot of sinusitis, a lot of drippy noses, that kind of thing. And today I did see somebody that had a nausea and diarrhea virus, so be prepared for all that stuff, and be aware. So you might want to, I'm not a big proponent of masks necessarily, but if you got the sniffles, or if you're going somewhere where somebody has been sick, then you better put a mask on. It might not help, but it certainly isn't going to hurt. And the same old principles that we've had forever and a day, well before COVID. Cover your mouth when you sneeze, cough and sneeze into your elbow. Wash your hands frequently. If you're sick, stay away, stay home, don't go to work. And it just kills me. This lady I saw today with the nausea and vomiting, the nausea and diarrhea, she'd been to work. Yeah, she was planning on going back. And I said, no, you can't go back to work. So I don't, and I realize that people need to work, and I realize some employers are hard to get along with sometimes when you call in, and some people might not have, any time built up or have vacation time or sick time. I get all that too, but that's how it gets spread. Everybody goes to work and says, well, I've got to work. And yes, we do, but that's one reason I was home the last 2 weeks. I didn't have a snotty nose or anything. I had vertigo, and I barely could keep my eyes awake and could barely keep my eyes focused. But we're going to go into that in just a minute. So there's a lot of reasons you can get lightheaded or woozy. One of the big, most common problems probably is sinus. You get your sinus pressure builds up, and it makes you feel a little dizzy. Your ears might ring a little, those kind of things. And that's probably one of the most common things. But there are other reasons to become woozy or lightheaded too. And it's more common again around older adults, so I certainly qualify for that in the older adult, although it's not usually life-threatening, but you do need to be careful. Don't ignore it. Even the lightheaded, even if the lightheadedness does not have a serious cause, it can lead to serious injuries from a fall. And at the worst, it may be life-threatening, says Dr. Grossman, who is an assistant professor of emergency medicine at Harvard Medical School. If you feel lightheaded or woozy, Dr. Grossman recommends having a drink of water or orange juice and lying down. If the symptoms last more than 15 minutes, he said it's time to seek medical help in an urgent or emergency care setting. Even if symptoms are brief, and even if you think you know the cause, report the lightheadedness to your doctor. So, why do you think we should drink some water or orange juice? Well, a lot of times we're dehydrated, and then that can cause some lightheadedness. We can have low sugar, so if you drink some orange juice, that will bring your sugar back up. So, sometimes it's just some common sense things that we need to look into. But, these are the top causes for lightheadedness, and most of them have a very common fix. So dehydration, we talk about that a lot in the summer because, we're outside, we're sweating, and we probably drink, but I don't know that we drink as much as we put out with our sweat and being outside. But you can become dehydrated if you're overheated, even if you're not eating or drinking enough, or if you're sick. I got my tea here. I got a little bit of a stuffy nose, so I'm trying to knock that out with some green tea. Without enough fluids, the volume of your blood goes down, lowering your blood pressure and keeping your brain from getting enough blood, causing lightheadedness. A glass of water may be enough to make you feel better, but if you haven't been drinking or eating much for days, it will take more than that to rehydrate your body. You may need an intravenous infusion of fluid, an IV, and then a doctor might need to check your potassium or your salt. And I just want to take a little side trip. I'm a rabbit trail girl. This hair is just driving me nuts. It's in one of those. I'm trying to grow it out so I can, have it a little bit longer. I want it to be about shoulder length, so you see I got a long way to go. But it's one of those stages where it just doesn't want to do anything, and it's just kind of flipping all over my head. But now I forgot the rabbit trail I was going to go down. Oh, the dehydration can really cause a lot of muscle cramps. So if you have a lot of Charlie horses, or if your legs are aching you at night, you wake up and they hurt really bad, try drinking a little bit of Gatorade. It has a lot of electrolytes in it. And I can't tell you how many patients have come to tell me how bad their leg cramps and the Charlie horses are. They drink some Gatorade and they're 100% better. So, we can lose salt, we can lose potassium, and other electrolytes, and that's all in. There's Gatorade, and it's Pro-Aid, I think. And there's a low sugar or a sugar-free Gatorade if you're diabetic too, so don't be afraid to drink it, and that does help a lot. And sometimes we can be lightheaded from from side effects of a particular drug. Sometimes medicines can make you feel lightheaded, especially those that make you lower your blood pressure or make you urinate more. And a lot of people take what is called hydrochlorothiazide, which is a fluid pill, a water pill, makes you pee. A lot of times our blood pressure is up because we retain fluid, so we pee the fluid out and then the blood pressure goes low. But of course, when you pee the fluid, then you're peeing out your electrolytes. That's why if you're on a hydrochlorothiazide or some kind of a Lasix or something, your doctor's going to check your potassium on a regular basis, because we can pee all that out with all the urinating that we do. And so, if you do, sometimes the blood pressure medicine is too strong, and so it lowers it too much, lowers the blood pressure too much, and that can make you lightheaded. Now, when you first go to the doctor, if you've been put on blood pressure medicine for the first time, or your blood pressure medicine is being adjusted because it's still too high, I tell my patients that you've got to be careful for the first 3, 4, 5 days, because when your blood pressure's up to here, and I give you medicine to bring it down here, it takes a couple, 3, 4, 5, even 5 days for the body to get used to the normal new blood pressure. So when you start on blood pressure medicine, you might have some severe reactions. You might have a bad headache. You might feel real woozy. You might have to hang onto the wall when you walk down the hallway to the bathroom. Those are all side effects from the low blood pressure and the feeling you get until your body gets used to the new normal blood pressure for you. And so, we can have a sudden drop in our blood pressure. The autonomic system helps regulate the shift in blood pressure when we stand up. And as we get older, this system may deteriorate, along with a lot of other things as we get older, causing a temporary drop in blood pressure when we stand and get up, and that's known as orthostatic hypotension that results in lightheadedness. This may be a long-term problem, but there are medications to treat it, such as midodrine, fludrocortisone, and if your doctor says that you need that. I've never heard of either of these drugs, and I've never prescribed them, so either I'm not doing something right, or this is a pretty old article, I don't know, or I'm just not up with all the latest and the greatest. And then if you have a low blood sugar, that can make you drowsy. When you don't have enough blood sugar in your system, every system in your body goes on reserve to use as little energy as possible, because the sugar gives us energy, including your brain, making you feel lightheaded or confused. You may only need a drink of juice to relieve your systems, and it's best to get your blood sugars checked, especially if you need more glucose in an intravenous or pill form. And a lot of diabetics, their blood sugar drops, and they've got to have sugar pills or have a piece of candy or something close by to suck on when their sugar goes low. Then you could have a heart attack or a stroke, and that's going to make you dizzy. So that's the most serious lightheadedness that you can experience. And symptoms of a heart attack often accompany lightheadedness are chest pain, shortness of breath, nausea, arm pain, back pain, jaw pain. Some symptoms suggesting a stroke are the sudden onset of a headache, numbness, weakness, visual changes, trouble walking, or a slurred speech. But in older adults, lightheadedness may be the only symptom of a heart attack or a stroke, especially if it doesn't go away. And in that case, you need to get to an emergency room for treatment. But one of my patients, She didn't have any of the, she had a stroke, but it was her leg, one leg felt heavy. She felt like she had to drag it. But fortunately, when she went to the ER and she told the doctor that, he was smart enough to order an MRI of her brain, and that's when they saw the stroke. So don't minimize your symptoms. Tell the doctor everything that you're going through, because you might not know that Judy, my patient, didn't know that was a sign of a stroke, but when she told her doctor, that triggered something in her doctor to get some more detailed testing. So you always got to do that. And then this fella says that how is dizziness different from lightheadedness? Your doctor might say, are you feeling lightheaded or dizzy? Although it's often hard to tell the difference, your answer may have a big impact on how the doctor moves forward with a diagnosis. Lightheadedness is not the same as dizziness, which is also known as vertigo, which refers to feeling like your surroundings are spinning. Common causes of dizziness include the medication that we talked about. And there's some disorders of the inner ear, tumors, a stroke that occurs in the back of the brain, Meniere's disease, which attacks a nerve important in balance and hearing. And then there's benign paroxysmal positional vertigo, and that's what we're going to be talking about in a minute. And that's when tiny crystals in the inner ear become dislodged and move around inside the ear canals. And then Parkinson's disease. So those are some things that we have to watch out for. So don't ignore dizziness, don't ignore lightheadedness. Vertigo can lead to fall and injury, and that's really the big problem with that. And in the elderly, it's too daggone easy to break a hip. When you break a hip, and you're in big trouble. So we don't want to do that. All right, it's time for, well, not quite time for our first break, but we'll go ahead and do our first break now. And when we come back, we're going to talk about benign paroxysmal positional vertigo, BPPV. That's what I had. That's what it's taken away really 2 weeks of my life. And so we're going to talk about that when we come back. So don't go away. We'll be right back after a word from these sponsors. Hang on.
When faced with special care needs for elderly or disabled loved ones, families want compassionate, comforting care. That's Tender Touch Home Care Services' goal, providing the level of care we would expect for our own. With over 10 years of home care excellence, Tender Touch provides an array of services that keeps your loved one at home. From personal care, light housekeeping, errands, and meal preparation, to our private duty care program, which combines all of our home care offerings in one package.
Tender Touch Home Care Services, where your needs are our concern.
Hey, welcome back. That was quick. I was reading a text message, and all of a sudden I heard Lee say 3, 2, 1. I went, uh-oh. So 2 weeks ago, I'd gone to bed Sunday night. Everything was fine. We'd gone to our life group at church and, had a good evening. And I was in bed my usual time between 9:30 and 10. And got up in the morning. The alarm went off, and I got up to get going to go to work. And I felt really, really dizzy and nauseated. And I thought, what the heck is this? And so I just kind of gently took myself into the bathroom, which is just right off of my bedroom, and I was running into the wall. I had to hold the wall to steady myself, and I'm like, what in the heck is going on? And I thought, sometimes I'll take something at night to sleep, and so I'm thinking, what time did I take that trazodone? Because that can kind of make you a little dizzy, I thought, what time no, I took that at, it was 12:30 or 1 o'clock, because I never take it past 2 because it can make you kind of dizzy, and it can also give me a hangover for work the next day. So I don't, I try to watch what time I take it. And I went, no, I didn't take that. I was thinking maybe I took it at 3 or 4 o'clock. No, I didn't take it that late. And so I got up and made the coffee, felt terrible, still was kind of woozy and like that. Made my coffee and got in my chair. I always drink my coffee, read my Bible, do my little devotional every morning. That's kind of my ritual. And I just did not feel good. And so I finished all of that. It was really hard for me to concentrate, hard for me to try to comprehend the words that I was reading. And I just couldn't figure out what was wrong. And I thought, well, maybe I caught a bug. Maybe I got sick from something. I thought about what I'd ate the night before, something like that made me feel bad. No, none of that didn't fit in the scenario I was thinking. So I got up and I was going to make my lunch. I was carrying my breakfast and lunch to work and make it at home. And I'd gone into my pantry and I went to get a sandwich bag, and that's up above my head. And so I had to flex my head back to look up, and I thought I was going to die. The room just went, whoo! And I had to quit looking up and look forward, and I said, oh no, there is something wrong with me. And so I called work and told them I wasn't coming in, that I was dizzy and I was really nauseated. And so I stayed home that day and tried to, well, when I called in, I said, I'll see if I'm better by about noon. I'll call and let you know by 11 if I can come in this afternoon. Well, by 10 o'clock, I was not anywhere even near feeling better. I'd been laying on the couch, and as long as I didn't move, I was fine. But if I rolled a little bit or turned my head a little bit, I just felt terrible. And I was so fatigued. Felt like I hadn't slept in a week. So I didn't go to work all that day, and then I didn't really feel any better. I was very fatigued. I mean, I was taking 4 naps a day. Now, I don't nap for hours. I nap for 20, 30 minutes. But that's very unusual for me. I have a pretty high energy level, and sometimes I get tired in the middle of the day and I'll lay down for 20 or 30 minutes. But, I mean, I was sleeping. And my poor husband, he's home. He has got some back problems, and he can't walk without it really being painful. So he couldn't do a thing for me. You know, he felt so bad because, you know, I would struggle to get up to go to the bathroom. I would struggle to get a glass of water. And the thought of eating was just, I was too nauseated to think about that. So I didn't get any better. And so I stayed home again. That was Tuesday. And Wednesday, I was still not any better, called in again. And a friend of mine came and picked me up. And because I'd posted on Facebook, I'll tell you what, you know, a lot of people have a lot of things to say about social media that I had posted, and it wasn't a very pretty statement that I said, vertigo sucks. And I got so many responses of people saying, I'm sorry to hear that, Linda. I'm praying for you. So I had several people call and say, can we pick you up and take you somewhere? One of my friends is a chiropractor, and she said, Linda, if you can get to the office, I can give you a treatment that acupuncture helps with vertigo. And, you know, I'm big on acupuncture. I've used that many times for ailments I have, primarily for tendinitis. So one of my acquaintances, and I don't really know her real well, but she retired last fall, and so she wasn't working, and she said, Linda, I'll pick you up and take you to see Tiffany, the chiropractor. I said, that'd be great. So she picked me up. I went and had acupuncture, and then she bought me lunch, beautiful sandwich and salad from Sal's Pizza. And it was just, it's really nice to have people care enough about you to do something like that, you know. But the acupuncture didn't really help, and I still felt terrible. So the next day, I said, I've got to go to the office and have somebody give me some medicine and tell me what to do, because you know, when you're sick yourself, I can tell you what to do, but when it all goes out the window, when it's you that you're talking about. So another dear friend, who incidentally sent me some flowers today, because she checks on me every day. How are you doing? And so I was sitting at my desk, and somebody from the front came and brought me this beautiful bouquet of flowers, and it was from my friend Julie. So that was really a blessing too. But anyway, so then Julie took me to the office, and I saw one of the PAs there, and was diagnosed with, I had already by this time diagnosed myself with vertigo. I had no idea that it was that debilitating. So I was doing maneuvers called an Epley maneuver, and that I've told my patients for years how to do it, and I have a little printout I give them. And so I was doing that, but it's terrible because you make yourself dizzy. You know, all you want to do is sit still and look forward so you don't have to move your head. But that's not practical. You've got to fix it. So then the next day, I went to physical therapy, and by this time I had called Select Physical Therapy, and there's only a few physical therapists in town that do vestibular therapy, but Select Physical Therapy is one of them. And so Eric took me in, and it was terrible when he was doing the maneuvers because what you do is you've got these crystals that have fallen out of your inner ear, and they need to get put back in place. And so you've got to manipulate your head. You got to flip down fast, and then he takes your head and rocks it back and forth and tries to get those crystals to move. And so it was terrible during the treatment, but afterwards I felt much better. And so I thought, oh good, that's it, I'm good, I'm great, don't have to worry about it. So I was supposed to go back the next day, and I didn't because I felt so much better. I thought, well, I'm only going to get better and better. That was not a good decision on my part. I've not made a lot of good decisions with this vertigo stuff I had. So I did not go on Friday, and I didn't get any worse, but I didn't get any better either. And so then then I went to work on Monday, and I do okay, and I'm decided I just have to learn to live with it. I can't bend my head back or lean over forward. I have to kind of keep my eyes straight ahead. If I drop something on the floor, I can squat down, but I got to look straight ahead and, you know, look for it and pick it up that way. I can't look down to pick it up because that will make me dizzy. So then last Friday, I said, okay, I'm going to go back to Eric now. I should have gone, and I didn't, so I'm going to go back. Well, he did the same treatment that he had done before that really helped me. But this time, it made me worse. I was so dizzy. I finally said, I can't do any more. Do not do any more maneuvers on me. I can't stand it. I feel sick. He had to bring a trash can into the room, you know, because I thought I was going to throw up. And so after I was there for about 45 minutes or so, I don't know how long I was there, I said, I've got to go. And I'd left my work and my pocketbook and everything at my workstation. And so I had to go back into the office. And I'd driven there myself that day. Well, I got halfway. Now, Select Physical Therapy is in the exact same building that my office is in. So it's not a long walk. I can't judge feet and that kind of thing, but it's not a long walk. I got halfway between Select Physical Therapy and the front door of the office, and I was in the foyer, and there's a trash can there. I had to lean over, and I was retching and retching. I didn't throw up, but I was so miserable and so dizzy and so disoriented. So I finally went in, they let me in, the nurses grabbed me, they looked at me and said, oh my God, Linda, what's wrong with you? I'm dizzy. I was so dizzy, I could not keep my eyes open. I had to close my eyes. So they put me on one of the exam rooms, gave me some Zofran, which is a shot for nausea. But I couldn't drive. I had to call a friend, and because Bob, my husband, can't come and do anything. He can't hardly walk. So I called a friend, and she came and picked me up and took me home. And then I got up the next day on a Saturday, and I really felt the best I'd felt in 2 weeks. I went, okay, if that makes me feel better, I'm good. So I was supposed to go to physical therapy again tomorrow, Friday, and I called and said I can't do it. At this point, I can't do any more of that. And if if this is as good as I get, I can learn to live with how I am now, and I can make exceptions. And I'm learning how to put everything at an easier place for me to grab, so I don't have to bend my head a lot. So I'm not getting as dizzy as I was. Sometimes when I lay down, I get dizzy, and it's only for a brief second or two. Sometimes I don't at all. So I believe I'm getting better. I've been praying a lot for healing, so I believe I'm getting better that way too. But anyway, that's my story of vertigo, and it's terrible, terrible, terrible. So I'm just going to go ahead, and that was my personal story. Now I'll give you the article about it, and we'll see if I missed something. I probably did. So BPPV, benign paroxysmal positional vertigo, is the most common cause of vertigo. The sudden sensation that you're spinning or that the inside of your head is spinning. BPPV causes brief episodes of mild to intense dizziness. It's usually triggered by specific changes in your head position that might occur when you tip your head up or down, or when you lie down, when you turn over, or when you sit up. So when I was in the throes of this terrible vertigo, when I got in bed and after this dizziness stopped, I wouldn't turn over on my side. I laid on my back all night, which is not comfortable. I like to lay on my side in a fetal position. I like to curl up, and that's how I sleep. But it wasn't worth the dizziness. And it can be very bothersome, but it's rarely serious, except for the chance of falls. And you can receive effective treatment for BPPV during a doctor's office visit. I don't necessarily agree with that, because it's really that vestibular training that the physical therapists use that does the trick. Now, I do have some exercises you can do yourself, but I tried to do them at home, and it just made me terrible. I had to really force myself. Who wants to get dizzy? So these are the signs and symptoms of the BPPV. Dizziness, a sense that you or your surroundings are spinning or moving, a loss of balance or unsteadiness, nausea, vomiting. I didn't vomit, but I sure had that nausea. They can come and go, and they usually last about a minute or less than a minute. They can disappear and then reoccur, which is not comforting to me at all. Activities that bring about the signs and symptoms vary from person to person, but almost always brought on by a change in head position. Some people feel out of balance when standing or walking. But as far as like I didn't hit my head, I didn't have anything like that. I just woke up from sleep with this vertigo. So there's no rhyme or reason when it comes. There's no rhyme or reason when it goes. It comes and goes as it pleases. It's kind of like, we call arthritis Uncle Arthur. Uncle Arthur comes and visits, and sometimes it goes soon, and sometimes he stays a while. It's the same with this vertigo stuff. It comes when it wants to, leaves when it wants to. So when you seek emergency care is if you have some of these following problems along with the dizziness, and that's a new, different, or severe headache, a fever, double vision or loss of vision, hearing loss, trouble speaking, arm or leg weakness, loss of consciousness, falling or difficulty walking, numbness, or tingling. Now those are almost all of those are stroke symptoms, and I did not have any of those, so thank you, Jesus, for that. There's no real reason known that causes this vertigo. It's called idiopathic vertigo. Idiopathic means we don't know what it comes from. When there is a known cause, it's often associated with a minor to severe blow to your head. And then you could have some kind of a disorder that causes damage to your inner ear, like Meniere's disease, or damage that occurs during an ear surgery, or long periods on your back, such as in a dentist chair. And I had to go to the dentist this week too, and I was really worried about that, but it wasn't too bad. And sometimes you can have this vertigo, and it's associated with migraines. I've never really had migraines, and so I'm grateful for that. That's for daggone sure. So inside your ear is a tiny organ called the vestibular labyrinth. It includes 3 loop-shaped structures called semicircular canals that contain fluid and fine hair-like sensors that monitor your head's rotation. Other structures, otolith organs in your ear, monitor your head's movements up and down, right and left, back and forth, and your head's position related to gravity. These otolith organs contain crystals that make you sensitive to gravity. For many reasons, these crystals become dislodged. When they become dislodged, they can move into one of the semicircular canals, especially when you're laying down. This causes the semicircular canal to become sensitive to head position changes it would normally not respond to, which makes you feel dizzy. It often occurs in people over 50, but it can occur at any age. And you know, I don't really consider 50 old these days. Maybe that's because I'm older than 50, but anyway. It's more common in women than men, and head injury or any disorder of balance organs of your ear may make you more susceptible to the vertigo. So that's the stuff about vertigo, and it's not nice. I don't like it. It was terrible. And then dizziness is used to describe a range of sensations such as feeling faint, woozy, weak, or unsteady. Dizziness is really the thing with vertigo. I mean, your brain is going like that. And I found out that the reason I was taking so many naps and the reason I was so fatigued is because your brain is working very hard to normalize itself. And it can't normalize itself because of the dizziness, and so that's what makes you tired. So then I didn't feel like such a slug. I thought, what is wrong with me? All I want to do is sleep. All right, we'll go back into dizziness when we come back, and it's time for our next break. So I will see you in just a few minutes. Don't go away, and we'll finish up with dizziness and what we need to know and when we need to seek treatment. Don't go away. We'll be right back.
Needs for elderly or disabled loved ones, families want compassionate, comforting care. That's Tender Touch Home Care Services' goal, providing the level of care we would expect for our own. With over 10 years of home care excellence, Tender Touch provides an array of services that keeps your loved one at home. From personal care, light housekeeping, errands, and meal preparation, to our private duty care program, which combines all of our home care offerings in one package.
Tender Touch Home Care Services, where your needs are our concern.
Hi, I'm Richard Kuss, pharmacist and owner of Almonds Drug Store here in Rocky Mount. Here today with my wife and 2 daughters. For over 75 years, Almonds Drug Store has been the pharmacy of choice for residents of Edgecombe and Nash County. Our family is proud to call Rocky Mount home, and we are excited about the new services and products we are adding daily at both of our Almonds Drug Store's locations and also at our medical supply store.
Come in and see us at Almonds Medical Supply. We're an extension of Almonds Drug Stores, your local hometown pharmacy. We're here to service all your needs, from wheelchairs to walkers to orthopedic supports to compression hose to hard-to-find wound care supplies. and you'll always get that hometown customer service.
We want our patients to pay the best prices, get the best service available, and have a better pharmacy experience than they will get anywhere else. Our staff is committed to going above and beyond to meet our patients' needs. Whether it is working with your provider to get you the best medication at the best price, contacting your provider to get you refills or a prior authorization, or taking the time to review each of your medications with you personally, or perhaps even helping you find an old-time remedy or other hard-to-find items, your Almonds Drug Store staff will work hard to meet your pharmacy needs. At Almonds, we will deliver your prescriptions for free. Both of our stores have drive-through windows, we guarantee short wait times, and our pharmacists will come out to greet you personally and answer any questions you have. If you want to be met with a smiling face, or even want someone to greet you by name when you walk through the doors, we are the pharmacy for you.
Call Almonds Drugs today.
443-3138 or 446-0014.
Hey, welcome back. Here's to your good health. I'm Linda Prezioso, nurse practitioner at Family Medical Center. We've been talking about dizziness, vertigo, and some of the reasons why we should be really cognizant of dizziness. And vertigo is a terrible thing to go through. It's not going to kill you, it just makes you miserable. So, and we decided that dizziness is used, there's lightheadedness, there's dizziness that kind of are used interchangeably, but I think we pretty much went through all this stuff on dizziness, so it's pretty much the duplicate of the vertigo. So one of the reasons that we can get dizzy that we have to really be mindful of is stroke symptoms. We can have heart problems. Our heart can stop beating for a small period of time, and that's called a pause. You can have a block in your heartbeat that causes the heart not to beat, and then that can cause you to be dizziness and pass out, and that's a heart issue that you have to have a pacemaker for. So, you know, it's not, you just have to figure out, and if you can't figure it out, you go to your doctor and let your doctor figure it out, what is causing the dizziness. So there's a lot of different warning symptoms for heart, and I'm going to go through all of them. Dizziness is one of them, but we're just going to go through several of them because, you know, this is February, it's heart month, and so we can have what we call coronary artery disease, and the most common symptom of that is angina or chest pain. Angina, I don't know if it's angina or angina, but anyway, it can be described as a discomfort, heaviness, pressure, aching, burning, feeling, fullness, squeezing, painful feeling in your chest. It can easily be mistaken for indigestion or heartburn, and then that, of course, indigestion and heartburn can also make you think you're having a heart attack, so it's interchangeable. Angina may also be felt in the shoulders, arms, neck, throat, jaw, or back. Other symptoms of coronary artery disease include shortness of breath, palpitations, you know, I feel like your heart's beating out of your chest, a faster heartbeat, weakness or dizziness, nausea, sweating. Symptoms of the heart attack can include discomfort, pressure, heaviness, pain in the chest, arm, or below the breastbone, discomfort radiating to the back, jaw, throat, or arm, fullness, indigestion, choking feeling, sweating, nausea, vomiting, dizziness, extreme weakness, anxiety or shortness of breath, and rapid, irregular heartbeats. During a heart attack, the symptoms typically last 30 minutes or longer. They're not relieved by rest or oral medications such as nitroglycerin. Initial symptoms may start as a mild discomfort that progresses to significant pain. Some people have a heart attack without having any symptoms, which is known as a silent MI, myocardial infarction. It occurs often in people with diabetes, because people with diabetes, their sensory is diminished because of the diabetes affecting the nerve endings. And of course, if you think you're having a heart attack, don't drive yourself. Don't call your mom and tell her to take you. Don't get your husband from work and say, take me to the ER. Call 911, because they can start treatment the minute they walk in your front door. So symptoms of arrhythmia. Arrhythmia is when your heart doesn't beat the way it's supposed to. You know, our heart goes boom, 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 boom. It's called regular sinus rhythm. But we can have abnormal heartbeats. We can have palpitations where our heart flutters, beats out of our chest, pounding in your chest, dizziness or lightheadedness, fainting, shortness of breath, chest discomfort, weakness or fatigue. You're so tired. And then there's atrial fibrillation. We're hearing a lot about that now. I see a lot of commercials on TV about atrial fibrillation. And most people experience one or more of these symptoms, which is heart palpitations, lack of energy, dizziness, chest discomfort, shortness of breath. Some patients might have atrial fib and not even know it, and those episodes may be brief. Then you can have heart valve disease, shortness of breath, or difficulty catching your breath. You may notice this most when you're doing your normal activities, making your bed, or when you lay down flat in your bed. Weakness or dizziness, discomfort in your chest. You may feel a pressure or weight in your chest with activity or when going out in cold air. Palpitations again. If valve disease causes heart failure, then you can have some swelling of your ankles or feet. You can also have swelling in your abdomen, which may cause you to feel bloated. Excuse me. A quick weight gain of 2 to 3 pounds in one day is possible with that. Symptoms of heart valve disease do not always relate to the seriousness of your condition. You may have no symptoms at all or have severe valve disease requiring prompt treatment. Or, as with mitral valve prolapse, you may have severe symptoms, yet tests may show minor valve disease. You never know. Anybody that's 65 or older, well, that's kind of a general age for me. But if they come in and say either they're short of breath or they're just so tired all the time, or they're short of breath all the time, I instantly think heart. You know, you got to think heart number one. Can't go far without a heart. And then a lot of shortness of breath is related to the heart. It's not related to the lungs. One of the problems we're having now in trying to differentiate all this, is COVID. And there's been so much shortness of breath with COVID and so much pulmonary problems with COVID that prior to COVID we would have pushed it all towards heart to rule out heart. And now there's so much, it's becoming so common with this shortness of breath that I'm worried that we're going to not look into the heart like we should and blame it all on COVID, and we can't do that either. So, you know, medicine is not black and white. It's all gray, and your provider has got to figure out which, what's causing this and what's causing that. And, we're all human and we all make mistakes. So sometimes, even with the best history, we miss some things. I try very hard not to, because that's my biggest fear, is that I'm going to miss something and somebody's going to get really sick. And that would devastate me. And I believe most providers are that way. We're not in the business to think we're hot stuff and we can do anything. We're in the business to make sure you're okay. So, heart failure. Now, what causes heart failure? Heart failure happens when you're, a lot of times you don't get enough oxygenated blood from your heart into your lungs. You know, our lungs and our heart are connected with each other, and heart failure can be caused by several things. One of them is an enlarged heart. If we're real heavy and our bodies are working hard to carry 350 pounds, that can cause some heart failure. Your heart can overwork for a multitude of reasons, and when it overworks, it's a muscle, and so it can get to be too big. Just like a bodybuilder, those muscles get so big. And so it's, we just have to learn how to do things in moderation, to eat right, exercise, move, eat healthy, drink green tea, drink water. I got it all over here tonight. To take care of ourselves. Our heart beats probably an average of 60 to 100 beats a minute. Now, I'm not a mathematician, and I'd have to pull out my calculator, but that's a lot of heartbeats in a lifetime. So, these hearts are good, strong muscles, and we've got to take care of them. But symptoms of heart failure include shortness of breath during activity, cough that produces white sputum, rapid weight gain. I mean, we're talking 2 or 3 pounds in a day, swelling in ankles, legs, and abdomen, dizziness, fatigue, weakness, irregular or rapid heartbeat, and we could have nausea, palpitations, and chest pain. Like valve disease, heart failure symptoms may not be related to how weak your heart is. You may have many symptoms, but your heart function may only be mildly weakened, or you may have a severely damaged heart with few or no symptoms. And I'll tell you, we are so blessed in Rocky Mount, North Carolina, to have top-notch cardiologists in this area, and we have a top-notch cardiovascular portion in our hospital that can take care of just about everything but a heart transplant these days. I remember years ago when I started at the hospital, and they had the cath lab, and everybody was so excited that you didn't have to go all the way to Greenville or all the way to Raleigh to get a heart cath. And that was just such a small little portion, but the hospital started out with that, and now they can do just about everything, and they've partnered with UNC Chapel Hill, and so we've got the best of the best that come back and forth from that hospital to ours, and we get them and they come here and stay, and so it's just, we're really blessed. No longer, now some people prefer to go to Raleigh, go to Wake, and there's nothing wrong with that. You've got to be comfortable with your provider, and you've got to feel comfortable where you're going to have your interventions done. And if you feel Rex is a better hospital than Nash, or that Wake is a better hospital than Nash, then you just go right on, because you've got to be comfortable where you're at. All right, then we have some congenital heart defects, and those can be diagnosed right after birth, before birth, during childhood, or maybe not until adulthood. It's possible to have a defect and no symptoms at all. Sometimes it can be diagnosed because of a heart murmur on a physical exam or an abnormal EKG or chest x-ray. And I think a lot of these young kids that, they're falling out in football fields and basketball courts and that kind of thing. And I think some of them are congenital that have not been recognized up until that point. And that's not poor care, that's not bad medicine, but you don't look for a congenital heart problem in a seemingly healthy 15-year-old, and they don't get unhealthy until they really exert themselves somehow. So symptoms of that are shortness of breath, limited ability to exercise, and you can have some of the symptoms of heart failure, one of which was dizziness. That's the whole reason I'm talking about this heart, is because of dizziness. And then heart muscle disease, it's called, it's an enlarged heart, it's called cardiomyopathy. You may have no symptoms, excuse me, or minor symptoms. But some of the symptoms of cardiomyopathy, which can happen at any age, chest pain, pressure, it's usually with exercise or physical activity, heart failure symptoms that we've talked about, swelling of the lower extremities that we've talked about, fatigue, fainting, palpitations, and dizziness. Some people have arrhythmias that can lead to a sudden death in a small number of people with cardiomyopathy. And lastly, we're going to talk real quick about pericarditis. And our heart is in a sac called the pericardium, and that can become inflamed, and that can cause chest pain. It's usually different than angina or angina chest pain. It can be sharp and located right in the middle of the chest. The pain may radiate to the neck and occasionally to the arms or back. It is worse when we lay down or taking a deep breath, coughing or swallowing. You can usually have a low-grade fever with it and increased heart rate. All right, it's time to go. I just wanted to touch on dizziness, and now that you know I'm a dizzy blonde, I will hope to see you next week with more of Here's Your Good Health. Good night. Have a great night, and stay warm and stay dry. Bye-bye.